Causes of angina pectoris. Angina pectoris, often simply called angina, is a clinical condition characterized by chest pain or pressure that occurs when the heart muscle does not receive enough oxygen-rich blood. To understand its causes, we need to explore the complex processes inside the coronary arteries, tosi, crucial, vessels that supply the heart itself with blood. In the United States, the most common underlying cause of angina is coronary artery disease, a condition marked by gradual plaque buildup inside the walls of the coronary arteries. This buildup is typically made of cholesterol, calcium, inflammatory cells, and fatty substances, collectively known as atherosclerotic plaque. Over time, this plaque hardens and narrows the arterial space, restricting blood flow to the heart muscle. When the heart needs more oxygen, especially during physical activity or emotional stress, the narrowed arteries cannot meet the increased demand, resulting in the classic discomfort known as angina. Another major cause is the rupture or erosion of plaque inside the artery. When plaque becomes unstable, it can crack and form a small blood clot at the site of injury. Even if the clot does not completely block the artery, it may narrow it enough to trigger episodes of angina, especially during exertion. This mechanism is more common in individuals with uncontrolled risk factors like smoking, poorly managed diabetes, or high cholesterol levels. In some cases, plaque rupture can progress to a full arterial blockage, which may cause a heart attack. But even before that happens, it can cause unstable angina, dangerous form of chest pain that requires immediate medical attention. A less common but important cause in the U.S. population is coronary artery spasm, also referred to as Prinzmittels, angina, or varia angina. In this condition, the coronary arteries suddenly tighten or constrict, temporarily reducing blood flow. This can happen even in people who do not have significant plaque buildup. The exact reason behind these spasms is not fully understood, but several factors are known to increase the risk, including smoking, exposure to cold, emotional stress, drug use, especially cocaine, and certain medications that affect vascular tone. Individuals with migraines or Raynaud's phenomena may also be more prone to coronary artery spasm because their blood vessels tend to react strongly to different stimuli. Symptoms of angina pectoris. The symptoms of angina pectoris can vary widely from person to person, but the hallmark characteristic is chest discomfort. Many people describe it not as a sharp pain, but as a heavy, squeezing, tight, or burning sensation similar to pressure, heaviness, or a feeling that someone is sitting on their chest. This pain is typically located behind the breastbone but may radiate to other parts of the body. The discomfort can travel to the left arm, shoulders, neck, jaw, back, or even the upper stomach. In some individuals, especially women and people with diabetes, the symptoms can be more subtle and may not follow classical patterns. Exertional chest pain is the most common presentation of stable angina. This means the discomfort appears when the person is physically active, such as climbing stairs, walking uphill, or carrying groceries, because the heart requires more oxygen during exertion. Once the person stops and rests, the pain often fades within minutes. This predictable pattern helps distinguish stable angina from more dangerous types. Emotional stress can trigger similar symptoms. A sudden argument, anxiety episode, or work-related pressure increases heart workload and may provoke chest pain. Cold weather can also bring on angina because cold temperatures cause the blood vessels to constrict, limiting blood flow. Shortness of breath is another major symptom. When the heart receives inadequate blood, it struggles to pump effectively, causing a sensation of breathlessness. Some people may feel as if they cannot take a deep breath or as if the air in their lungs is insufficient. This symptom may appear with or without chest discomfort. Fatigue is a common and often overlooked symptom, especially in women. Many female patients report feeling unusually tired or drained during routine activities, long before they ever experience chest pain. This fatigue results from the heart attempting to work harder despite inadequate oxygen supply. Nausea and vomiting can accompany angina episodes, particularly when heart strain becomes significant. Sweating, dizziness, and lightheadedness are also typical symptoms. The body activates the sympathetic nervous system in response to stress on the heart, which can lead to cold sweats or a faint-like feeling. Some people experience a sense of impending doom or unusual anxiety during an angina episode. This is the body's natural response to reduced oxygen delivery to vital organs. Unstable angina, medical emergency, produces symptoms that are more intense, unpredictable, and persistent. Unlike stable angina, this form can occur at rest, during sleep, or with minimal activity. The pain may last longer than 10 minutes, may not improve with rest, and can get progressively worse. These episodes may be a sign that plaque has ruptured or that a clot is forming inside the artery, placing the person at high risk of a heart attack. Treatment of angina pectoris. Treating angina pectoris involves a multi-layered approach aimed at improving blood flow to the heart, reducing symptoms, preventing complications, and addressing the root cause of the condition. Treatment plans often combine lifestyle changes, medications, and medical procedures, depending on the severity. Lifestyle modification is the foundation of angina treatment. In the U.S., where risk factors such as obesity, high cholesterol, diabetes, and smoking are common, lifestyle intervention plays a particularly significant role. Patients are encouraged to adopt a heart-healthy diet rich in vegetables, fruits, whole grains, lean proteins, and low-fat dairy. Reducing saturated fats, trans fats, and processed foods helps to lower cholesterol levels and slow plaque progression. Regular physical activity, under medical supervision, improves blood circulation, strengthens the heart muscle, and helps maintain a healthy weight. Quitting smoking is one of the most powerful steps a patient can take, as smoking dramatically increases the risk of arterial damage and clot formation. Stress management is also crucial. Mindfulness, meditation, deep breathing, yoga, and therapy can help reduce the physical impact of stress on the heart. Getting adequate sleep is another important factor, as poor sleep increases blood pressure and inflammation. Medications play a major role in relieving symptoms and preventing heart attacks. Nitroglycerin is the most common medication used for rapid relief. It works by dilating the coronary arteries, improving blood flow, and easing chest pain within minutes. Long-acting nitrates may be prescribed to prevent frequent episodes. Beta blockers are widely used in the U.S. to reduce heart workload by slowing the heart rate and lowering blood pressure. Calcium channel blockers help relax and whiten blood vessels, making them especially useful in cases of variant angina caused by artery spasms. ACE inhibitors, or ARBs, are often prescribed to protect the heart and reduce blood pressure, especially in patients with diabetes or kidney disease. Statins are essential for lowering cholesterol and stabilizing plaque. These medications significantly reduce the risk of heart attacks and are standard therapy for most patients with angina. For individuals with blood clot risk, antiplatelet drugs like aspirin or clopidogrel are commonly prescribed. These medications prevent platelets from sticking together and forming dangerous clots. In the United States, daily low-dose aspirin is often recommended for patients with known heart disease. Ranolazine is a newer medication that helps relieve chronic angina by improving the heart's metabolism. It is particularly useful for patients who cannot tolerate other medicines or whose symptoms persist despite treatment.